with the CTIWP and the EBMT, we're able to perform a survey to assess how we choose the CAR T-cell product, because as you know, there is so far several products that have been approved to treat aggressive B-cell lymphoma. There is a tisa-cel, the Axi-cel, and the lymphocytes. The label of the product are not exactly the same, but there is a lot of overlap. So it was important to know how each center choose between one product rather than the other product. In fact, we have some data from 67 centers from 20 countries in Europe. The majority of the centers will use two products, and it was mainly the Axi-cel and the tisa-cells. The lymphocyte was used in only 14 centers. So we decided to compare the use of Axi-cel on tisa-cells. What do we find is that the centers think that it was the Axi-cel that has the broader label. Regarding the lymphocyte process, it was very similar regarding both product. It was also in favor of the Axi-cel regarding the lymphocyte workload and also the availability of the manufacturing slot. Regarding the effectiveness of the CAR T-cell, the majority of the center thinks it was Axi-cel that was the most effective treatment. And on the opposite, the majority of center thinks tisa-cel was the less toxic CAR T-cells. And in fact, this lead to some different choice to treat different kind of patients. And in fact, patients with elderly patients, they will use more tisa-cells, but for patients with some bulky disease, it will be more Axi-cel that are going to be used. And similar to treat young high-risk patients, it will be also be more use of Axi-cel. To conclude, we see that the majority of centers have access to more than one CAR T-cell product. That for the majority of patients will think that Axi-cel is more effective and it will be used in young and aggressive disease, while tisa-cel seems to be safer and it will be preferred in elderly patients.